A noted surgeon slams national health insurance as a political ploy. The former deputy prime minister questions where that revenue is going. The TUC commends government for resolving outstanding union issues, plus preliminary damage assessments on 2 hurricane-impacted islands nearing completion. We've got those stories and more coming up tonight. I'm Dana Smith, and NB12 Weekend starts right now. Thanks for joining us. A leading surgeon and former F&M senator is blasting the Christie administration for what he calls its poor handling of national health insurance. Dr. DUANE says at this point it's clear the scheme is nothing more than a political ploy. Jasmine Brown reports.
Sands says at this point it's clear that NHI is being used as a political ploy by the Christie administration.
Sands says considering little has been finalized concerning NHI, he highly doubts that the Christie administration will be able to put in place a proper scheme in time. Dr. Sands suggested that the government is nowhere near where it should be in its quest to facilitate a proper January 1st, 2016 rollout of what is the proposed national health insurance scheme.
But having practiced now in the Bahamas for 21 years and having been a physician for 30 years, it worries me where this conversation is headed.
In early September, Health Minister Dr. Perry Gomez revealed that the government is a little behind on meeting the benchmark set by itself and its international consultants for a successful rollout of the proposed scheme. Prime Minister Perry Christie revealed on Wednesday that the government is considering introducing a tax to fund NHI in the next fiscal year. Sands says before the government can even talk about taxes, it needs to explain the entire plan to the Bahamian people. Sands said the Christie administration's approach towards NHI is no longer about transformation of the healthcare system, but is now about achieving political points in time for the next general election.
Apart from being used as a tool to uplift Bahamians, is now going to be a tool for re-election. Damn the torpedoes. If we destroy an industry, not a problem. If we bankrupt the country, not a problem. But let's give people something that they want, even if we can't afford it, because it's something that's going to get us elected. There has been a challenge having the political will to provide the quality of health care that Bahamians need. We have maintained medical apartheid in the Bahamas. So some get it and others don't. And now the others that don't are going to be used in order to achieve political success.
He adds that if the government is serious about implementing NHI, it would put an end to the confusion by being more upfront with the facts.
So the conversation is confusing, Mr. Prime Minister, because you've made it confusing. And the fact that there's a cloak of secrecy now.
The government has set a January 1st implementation date. Sanagest International, the government's NHI consultant, presented several options for NHI ranging in cost from $362 million to $644 million annually. However, the Bahamas Insurance Association put the annual cost at around $1 billion. Reporting for NB12, I'm Jasmine Brown.
While the government has announced plans to implement national health insurance next year, Chairman of the Chamber of Commerce, Gowan Bowe, insists there is still too much confusion concerning NHI.
The challenge that everyone is now facing is being able to get the pieces of information together so there's an agreement on facts and principles. And despite the utterances by private sector, by the government, by the advisors, etc., the reality is everyone still hasn't come onto the same page.
Bo says, like value-added tax, proper studies need to be done to determine exactly how much the Bahamian people should be taxed.
It's important now that we get at least agreement on facts. And we have agreement in principle on how the assumptions are being built. And I think there's still a very wide disconnect. As it relates to are we watching this? Yes, the Chamber of Commerce itself has an NHI committee. And the biggest thing that comes back to the wider board is from the perspective of, well, we are still waiting to see the details of what is making up the proposal. And from that perspective, the only way you get buy-in from anyone is at least saying, well, these are the facts and issues that we have at hand. You don't have to agree with them, but if you're saying, I don't even know, throwing a dart in the dark isn't one aspect that people want to do. You don't know where it's going to end up.
Meantime, the Bahamas Insurance Association has been vocal about the lack of consultation. Well, in the wake of government's announcement that it's considering a new tax to help fund NHI, former Deputy Prime Minister Brent Simonet is questioning what is going on with the last tax this administration implemented.
Where's VAT money gone? Has public expenditure gone up on now I understand Minister Halkida says you can use the VAT money for the hurricane relief. So it's against that background that I see the report in the newspaper that national health insurance will have another tax. Well, if your unemployment is 37% amongst young children in the outer islands, there's only so much you can tax us.
The Central Bank of the Bahamas' monthly economy report for July revealed that VAT revenues for the first 5 months of the year totaled $182 million. But Simonet noted, despite the tax's introduction, the national debt has jumped by more than $580 million, for a total national debt of more than $6 billion. Noting VAT was introduced to help lower the national debt, Simonet says he wants to know where the money went.
If my memory serves me right, VAT was introduced as a way of paying, one reason was to pay the national debt. The other day in the newspaper, the national debt went up. But they've also said they've earned X millions of dollars from VAT. Where's the money gone?
F&M Deputy Leader Peter Turnquest last month charged that government is defensive, personal, and belligerent over its VAT policy and secretive about where exactly tax dollars are being spent. Simonet echoed those concerns and questioned if VAT revenue is being used to fund new infrastructural works.
You know, I see a lot of roads and sidewalks and other things. So are we spending the money on projects that are not going out to bid, not necessarily 100% needed, politically motivated, whatever the reasons are, and not considering the national debt, which this government slammed the F&M for doing, and now they're doing exactly the same.
Simonet called on the Prime Minister to forget the rhetoric and simply give the nation the real figures. He also called for the Freedom of Information Act to finally be fully implemented.
The F&M left the Freedom of Information Act there. Left it there. All kind of problems with it now under the PLP voted for it. You still haven't got it. That's, so get on with it.